Shalom, I'm the Jerusalem chiropractor Dr. Yitzchak Freeman, and since beginning to work in 1987 I've had the honor of treating hundreds of women for pregnancy or several pregnancies by now, for heartburn, head, neck and back pain, disc problems, numbness and tingling into an arm or a leg, and getting women ready for the big event. Many of them continue out with their next pregnancies because they had a quicker and easier birthing process. After birth, multiple births or C-sections especially, there's problems with urinary frequency, there's problems with the pubis symphysis, with the coccyx bone or the sacroiliac joints. Breastfeeding women have problems between the shoulder blades, pain in that area, and I want to show you this journal article from 2013. The #1 journal in obstetrics is called the Journal of Obstetrics and Gynecology, or the American Journal of Obstetrics and Gynecology. It's not in the easiest English, so I'll help you read it. Let's take a look. I found this very interesting article by running a search using chiropractic and pregnancy as my search terms on the PublicMed government, U.S. National Library of Medicine, their Institutes of Health, and I got 72 good journal articles from refereed magazines, refereed medical and health journals, but because I'm a clinician, I'm more interested in clinical trials, and it turned up one article from the American Journal of Obstetrics and Gynecology, a rather new article, 2012. It was presented at their annual meeting in Dallas, Texas in 2012. And it looked at comparing multimodal, that means using different interventions, and comparing that to standard obstetric care for low back pain and pelvic pain during pregnancy. We had 169 women, starting at 24 to 28 weeks of gestation and following up. Now the results were at 33 weeks. They used chiropractic specialists to provide manual therapy, stabilization exercises, and patient education. This was compared to, the conclusion was that the multimodal approach benefits patients more than standard obstetric care. In the standard obstetric group, the following remedies were used: rest, aerobic heating pad, maximum for 10 minutes, and acetaminophen, which is Acamol or Tylenol, narcotics if the pain was greater, and referral to an orthopedic or neurological services was used for debilitating back pain. In the chiropractic group, they tested muscle tension by clinically palpating it with their hands, treating it with post-isometric and relaxation, and myofascial release. So these are some techniques that most chiropractors use. The exercises they used is less well known by chiropractors, physical therapists, or orthopedists, but it's pretty new, and it's just a standard protocol for low back and pelvic stabilization. This 26 leads us down on the bottom of the page to Stuart McGill, professor of spinal biomechanics, and he wrote a book, Low Back Disorders from Human Kinetics, and this book, well, first who is Stuart McGill? So if you Google him, he wrote the big three. Here it is, for the lower stomach, for the side muscles, and for the back muscles. There he is. And who is he and why should we listen to him? Well, the Canadian Centre for Occupational Health, in teaching the general public to have a healthier back, they base this page on his book, and he says that stabilizing the spine seems to be the answer. And the Israeli Mossad HaBtichut copied pretty much these guidelines. And here is the bird dog, here is lower stomach muscle, and here is side bridge. Now, why should women decrease pain during pregnancy? Well, everybody wants to feel better, and there's other reasons also, as we can see from the government study in Australia, the Mother and Baby Report of 2009, which is summarized right here, that if you go to a private hospital where they want to make things go along a little quicker, they had a 66% of the women getting an epidural anesthesia, as opposed to public hospitals using it less to keep the costs down, and also other problems. There are good things for having an epidural, especially if you're going to have a C-section, and if you have preeclampsia, high blood pressure, you don't want to have a general anesthesia, but there's a lot of negatives. So for a regular birth, it might be better to have the woman take care of herself, getting prepared for it, because epidurals interfere with your body's natural release of oxytocin. That's the love drug, and those are the ones that cause the uterus to contract stronger. There's the cascade of intervention, and then that makes it 3 times more likely to be given oxytocin, have a forceps extraction, 160% increase, and some researchers say even a 200% increase of cesarean section rates. There's itching of the skin afterwards, and a numb patch around the place where the injection went in the back, shivering, and 1 out of 200,000 will be crippled, and some have problems 3 months afterwards. Can't move around during the pregnancy because your legs are numbed. Also, the medical doctors are looking more and more in America. There's the Maternal Childhood Health Journal, 2010. And their conclusions was that epidural anesthesia increased the risk for operations. This is a table, a knee chest table I use in my clinic. And here we can see a pregnant woman on it. There's plenty of room for the stomach right here. She's on her knees, her face is in the slit there. And I like to use this table also. It goes motorized up and down here, and I can push and relieve back pain here, feel the muscles and feel the vertebra. There's room here until at least the 8th month. If I put some pillows under here, raising the pelvis up, I can work through the 9th month. I invite you to contact me, and if you live far from Jerusalem, give me a call. I'll recommend one of my colleagues in your area. I wish you an easy pregnancy and speedy birth.